Weird.
Okay. I'm nervous. I wasn't expecting to be nervous. Hi, Kenzie. How are you?
I'm good. How are you?
Good. I'm Melissa. I'm going to be your SPT today. Okay, we're going to go over some of your muscles in the ankle. I see that you just had a left Achilles repair. Okay, cool. Are you having any pain right now? Not really? Okay. Okay, so what I'm going to do first is grab my paper. So are you reading your patient? No, I'm not reading the patient.
She just needs her paper.
Yeah,
She has my paper.
I just...
She's so cold.
Okay. Alright, so I'm just going to kind of educate you a little bit about when you're laying in bed. Sometimes you can get edema, and that's just swelling here with your ankle. So I'm going to show you how you would lay. I would want you to have your left lower extremity elevated. So I'm going to have you lift up like this. Good. And you said you're not having any pain? So 0 to 10, what would your pain level be?
Like a 1 or 2.
A 1 or 2? Okay. So the main goal here is to make sure that the bony prominence is, that there's no pressure here. I am gonna fold up another towel here because you had the surgery right there. I want it to be exposed. That way you're having no pressure on there. Okay? Awesome. Okay, so is that okay? How does that feel? Good. All right, so for this next portion, I'm going to show you the muscles here that would, I'm going to drape you. There you go. And we're just going to keep the one leg exposed. Okay. All right, so from that post-surgery, it's gonna affect the muscles posterior right here above your calcaneus. So that's right here, your left bone. And then I'm gonna also point out your fibular head, so it's right up here. And then also your medial and lateral malleoli. So medial is more inner, lateral is on the outside. And then the muscles that are affected from this is your gastrocnemius, so that originates on the lateral and medial condyle of the femur, inserts on the heel right here, your calcaneus. And then the actions for that are knee flexion and assisted plantar flexion. So I'm going to show you plantar flexion. The normal range for that is about 50 degrees. Okay, and then when you bring your toes back, normally it would be 20, but I'm just going to bring it back to neutral because I don't want you to stretch or elongate that muscle, okay? All right, and then another muscle I have is the anterior tibialis. So that's going to be on the lateral tibia and your interosseous membrane. So right about right here, and then it's going to go all the way down, distal, and then it's going to go, no, I'm lying. It's going to go all the way down and go onto the first cuneiform and first metatarsal. So that does ankle inversion and then also dorsiflex. So inversion, we're going to go like this. The normal range for that would be about 35, so right about like this. And then it also does dorsiflexion, but remember right now I don't want you to go further than neutral. Okay. And did they talk to you about what you should and shouldn't do post-surgery? Okay, what did they tell you?
No, you can't walk on it.
Okay, now wait, good, right, good.
But I didn't follow that direction.
Why? What did you do?
I went fishing.
You went fishing?
Yeah.
How did you get to the shore?
I walked.
You walked on it. Did you have any
I
pain
fell
on
a
you?
few times.
You
but-
fell? And you fell and you have 2 out of 10 pain right now?
Well, that was 2 weeks ago.
Oh, okay. So let's not do that for a while until the doctor clears, okay? So we don't want to do that. We don't want to put weight on that muscle. That way it can take some time to heal. And we don't want your, we don't want you to dorsiflex, so like I showed you earlier, and we don't want it to rupture. And then, so another muscle I was going to show you was the fibrillaris longus. So that's going to be lateral proximal fib and your interosseous membrane as well. And that one's going to go all the way down underneath to the plantar surface of the first cuneiform and metatarsal. And that one does eversion, so bringing the toes out this way. And then it also assists in plantar flexion. And then that eversion normally ranges 15 degrees, so you have a range, which is really good. So we went over those, and then again with your talar crural joint, same thing. I told you that it does plantar flexion and dorsiflexion. Okay.
I think that's it. She just
I think
wanted us
that's
to
it.
do
Is that it?
fishing.
Is that it?
For your positioning,
You want me to sit her up at the edge of the bed for no? So that's pretty much it.
that's pretty much it. Any fine tunes?
A lot. A lot. Yeah, vitals. I didn't.
You were touching her incision side a lot. I know it's not there, but
Yeah.
you were touching it.
I was touching you right here. Yeah.
You do want to be mindful of that.
Mhm.
It's a lot easier to do with a patient that really has an incision, but we have to be better at pretending.
Mhm.
Okay? So who came in with your patient?
And I don't think I didn't talk to him as a
It
caregiver.
was like non-existent.
Yeah.
It's like a
I.
So, guys, when you come into the
signed.
room, if your scenario says that
Hey.
you have to educate the caregiver, introduce yourself to them right away. Bring them into the conversation almost immediately. Okay?
Okay.
Because that caregiver has some important information to share about the behavior of this patient.
Okay. Do you want me to position her to the edge of bed? And then
Nope.
Okay.
I do not.
Done.
Alright?
Good job, Nick.
Linens. This isn't
Thanks.
something
Great
that
son.
we talked about with any of the other.
Kenzie's use permanent patient?
You did
Sure.
This is not something that we talked about, but make sure you have all the linens you need. We don't, or how do we prepare pillows for patient care?
I'm just still going.
So make sure that you're grabbing everything. You do not want to put an unprotected pillowcase or unprotected pillow under a patient's body. You always want to make sure you're putting clean pillowcases on.
Are you recording?
Mm-hmm, yo.
Don't do what I did.
Only if needed.
Stage fright.
Only
Right, but if you're elevated.
You got it. Just got stage fright.
If you're elevated,
And if it's
Well,
just,
He was the
But
only
when
therapist
later
who
on
said
you
he
have
didn't
a
do it.
position that
I
you have more than
told you I
one
didn't
pillow,
listen.
and now you've got a pillow without a pillowcase.
But if you need another pillow, you just put it under it. The
But you're gonna use that pillow for positioning later on. You're going through the whole scenario. Her
I
question
see.
was, can I not elevate the patient and not put a pillowcase under the lower pillow? Technically, yes, but you have to assume that at the end of this session, you're going to be positioning that patient for something. So now you've still got a pillow without a case on it.
But that's all stuff you can do during your prep time. You can make sure all the
Absolutely.
pillows are covered
Yep.
and
You sure can. You sure can. So make sure that you're doing that, that you're grabbing all the linens, that you're not putting something under your patient that's not covered with linen.
During our prep time, would that be like cleaning our areas as
It's
well?
not gonna
No?
be cleaning everything,
Okay.
because your patient's already gonna be in one place or another
Oh,
when
okay.
you come in.
Alright.
So I don't know who the next patient's gonna be, but we'll see. This is the incision.
Okay.
What's next?
Alright. I'm going to pause it.
Oh yeah, let me take a picture of that too.
I'm happy that you addressed the edema.